Good evening, DTLC family. Welcome, welcome, welcome to DTLC Season 13, Week 11. Well, can you believe it? Week 11 is here. Quite unbelievable. We are almost at the 3-month mark. 11 weeks ago, we started this journey together, learning, asking the questions, and changing the old habits, and sometimes doing very well, sometimes struggling, but most importantly, continuously showing up here week after week. So wherever you're joining us from tonight, give yourself some credit. You are still here, and that really matters. Tonight, we are talking about something that I think is sometimes forgotten when we talk about diabetes. We talk about blood sugar, the HbA1c levels, the food, medication, and exercise. But tonight, we are going all the way down to our feet. Here's something interesting. Did you know that what happens on your plate can eventually show up on your feet? When blood glucose remains high over time, it can damage the nerves and blood cells that supply the feet. This means a person may develop a small cut, a blister, or injury and not even feel it. Well, I really don't want to talk about that so much because tonight we are meeting a podiatrist. Have you ever consulted with one before? We have the privilege this evening. Our special guest tonight here with us is Dr. Sally Kariuki, a podiatrist. And now some of you might have been asking, have I really ever heard of one? Tonight we have that privilege. And of course, with us this evening, we also have our dear Dr. Ojwang, our lead dietitian. Of course, she will help us connect what we have been learning throughout DTLC with protecting our long-term health. By the end of tonight, I hope every one of us will be able to look at our feet differently and perhaps even look at our shoes differently. But before we get into tonight's teaching, as usual, we want to begin with a testimonial. And tonight's message is particularly important for somebody out there. Somebody who is thinking, we are already in week 11, but I haven't achieved what I wanted. Perhaps you've heard other people sharing their victories, their blood glucose improved, they've lost weight, they're exercising more, they're eating differently, and you're thinking, what about me? I should have done better by now. If that's you, this next message is especially for you. Well, it comes from one of our wonderful DTLC facilitators. She's called Professor Hiba Osei Kwasi, straight from the UK. She's a nutritionist. And some of you might have met her before, but this season turned out that she had a busy schedule and she wasn't able to join us. But she wanted to leave you with this encouraging thought. So, especially for those who feel that they should have done better, please listen carefully to this testimonial.
I told you my motivation, just losing weight, getting that practical support in order to support myself, my family, and people within my network. Along the line, I started getting, what you see. This is me. All those things you see there are stuff that I started getting for months. Dr. John and I tried. My doctors here gave me medication. It wasn't just going away. We tried intermittent fast. We did so many things. It was just not going away. Now, after being on the DTLC, the pilot was called Sahara TLC. Strangely, unexpectedly, because the medications were not working, so I stopped. I gave up on it, and I was just living with it, And then suddenly, these things, so that the doctors called it idiopathic urticaria. So it's idiopathic means unknown. So, I'm getting all of these, if you like, call it allergies, but we didn't know the causes of these allergies. Now, having been committed to, the lifestyle change program we're doing, after a while, all of these allergies and itches and swelling just vanished. Now, this was not a goal I set out for myself because I didn't even know I had this, but focusing on everything we had in the plan led to me feeling better. And I can proudly say that ever since that time, I haven't really experienced this. Now, what is my message to you? I had a lot of people talking about, their the positive stories. Every now and then there would be some people who might not see these changes other people are talking about. It happens, and it's to people like that that I have a message to. So whatever the changes are, even if you are not seeing it, even if it's not visible, because one or two people might say they didn't lose weight, even if it's not visible to you, it is doing something really good in your body. In my case, this other thing that I didn't even set out to do was corrected. You can't go wrong when you make healthier lifestyle choices, is what I'm trying to say. So don't underestimate the value of the small changes we make on this program. The effects will multiply as you keep repeating them. You might not see, I know lots of people see immediate results, but this is specifically for any person who might not have seen the changes they wanted to see. You just have to keep going at it. Keep going at it, and eventually you'll be successful. You would see some results.
All right. Well, that's from one of our facilitators, yeah, Professor Hiba. And of course, explains the condition that she had. You can probably just do some research about it. It's something with some skin condition. And of course, how are you feeling after listening to her speech? Do you feel encouraged? Remember, your journey does not have to look like somebody else's journey. If you haven't reached your goal, don't use week 11 to condemn yourself. Use week 11 to ask, what is one thing I can still do differently? We are not yet finished. We are still here. And speaking of small intentional changes, let's go back to our challenge of the week. Well, last week you had a very interesting topic, management of stress, especially when living with chronic disease. So, Dr. Alice, we would like to invite you and take us through this recap. Welcome.
Hi, everybody. I hope we're doing very well. Thank you, Lydia. And thank you, Dr. Sally, for being here. The feet are so important. People don't know that. But yes, you will always learn something new with Dr. Sally. So I don't know if you did your challenge. I'm sure one or two people did their challenge. And the challenge was that last week we had a session on stress management. And so you're supposed to identify one of the types of stress management and apply it through the week. So I'd like to ask Awor. Awor, are you here? You can come and be here with me. Where's your camera? Can you just help us remember what are some types of stress management? And anybody who can remember, put in the chat what you can remember. Let's be engaging. What can you remember? What are some types of stress management method you can use to manage stress? What are some of the methods? Well, one method is get yourself away from the stressor, and you have to think, what is my stressor? If your stressor is your boss, what do you have to do? If your stressor lives with you, what do you have to do? If your stressor is one of your friends, what do you have to do? Sometimes it's not just easy to get away from the stressor. You have to think about it. Okay? Yes, that is one. So you get away, go for a walk, do something, and reduce the stress levels. Yep. So, Lydia, what do you remember from last week's session?
Well, definitely I was away, but I have attended this session before. And of course, sometimes we just need to talk to ourselves. Yeah, because It all starts in the mind. I remember Dr. Deche really expressed this, that it all starts in the mind. And sometimes we need to talk to ourselves. You know, I remember one time he said that if you can't tell somebody something rude about them, then why should you tell yourself that? If you can't tell somebody you're not looking good or you're ugly and all that, why would you tell yourself that? Yeah, so that really stuck with me. Sometimes we have to change our mindset. Yeah.
Thank you. Thank you very much. Thank you very much for sharing. I see in the chat, Nemali has said meditating. What do you do about meditating, Nemali, as a form of stress management?
Hello, everyone. So as a form of meditating, as a form of stress management, it's a way in which whereby you have to, for instance, go out in nature, do activities that calm your mind, and it is also a way to naturally get you away from the stresses. So it's a really good thing to always do consistently and also have it as part of your routine once in a while.
Not once in a while. It needs to be very, very regular. It's supposed to be very regular. And also part of meditation can also be journaling, where you actually journal, how could I have handled this? Because sometimes because of stress, we are also affecting other people. It's not just us, Because you're stressed, you're impacting other people negatively. So if you've overreacted, then you can come back and journal and start to think, how could I have reacted? What could I have done better? So if you keep a journal and you keep reviewing your day and you keep thinking about what happened, what you could have done better, what can you do to improve yourself, that automatically helps you to relax, okay? As somebody said here, sorry, somebody's ringing my bell. I'm not expecting anybody. Yeah, I'm sorry about that. So, can you remind us all the 6? Please join me here. And then yes, I was calling you to remind us of the different types of stress management. We've discussed meditating, we've discussed moving away from the stressor. I can see the team, maybe 1 or 2 that you can remember, and then how you did your assignment. Thank you.
Yes, my network is quite bad.
We can hear you. You can probably put off your camera and speak. Maybe it will help.
From the stressors.
You can put off your camera. That might help with the... Okay. All right. The network is bad. Let's read what one of our friends has said here. It says, setting boundaries. For example, if someone is being rude to you, you can let them know that you can continue the discussion when they have calmed down, and make sure you guard those boundaries. Yeah, I like that. Don't have an exchange. Don't have an exchange. An exchange doesn't help anybody. You only come out of that exchange feeling a bit bitter and stressed out. Yeah. Very good for sharing. And then nutrition, maintain a healthy sleep hygiene, bonding with nature. So yes, maintain good sleep hygiene. And of course, when you're managing stress, you always have to think about, rule out your lifestyle. What is my lifestyle? Because when you have poor lifestyle, you don't sleep well, you don't eat well, you don't hydrate, you don't do the natural things, then everything only gets worse. So then you have to be, okay? You have to be, so you have to do the lifestyle first and then identify the stress and separate it from lifestyle, because remember, if you eat nothing for breakfast, you're tired in the evening. You eat a large meal in the evening, you're tired in the morning. If you do that every day, you're tired every day, you're tired every day. And then you have stress from emotional stress, from relationships, from work, then you feel worse. Yeah. And then we also have somebody from YouTube, thank you very much, that has said, walking helps me to manage stress. Yeah. Walking is a natural stress booster, or just exercise, because when you exercise, you produce what you call endorphins. And endorphins is a feel-good factor hormone. So you feel good. In fact, there's a saying, there's a quote that says that sports people can never commit crime. And it is so true. So you just need to, and that's why you see like they try to invest in sports, especially in the slum areas, put fields, because when you exercise, you produce endorphins. It's a feel-good factor. You feel good, you feel confident. So this is why exercise should be part of our routine. Yeah. Thank you very much. Is there anybody else who did their assignment? Okay, if you don't, then I will give Lydia. Lydia, I have to deal with something here. I have a sick child visiting me here. Let me help them out, okay? Thanks.
All right. Well, thank you. Thank you so much, Dr. Ojwang, for taking us through that review. Please, as we usually recommend, try out these challenges. There's a reason why we bring even Dr. Nelly here to talk to us, the psychologist, to talk to us, because for sure, stress is a contributing factor to high blood sugar, obesity, and so many other conditions. So thank you so much. All right, so now it's time, friends, to meet Dr. Sally. Dr. Sally, we are glad we can see you. You look ready. Well, a brief introduction of Dr. Sally Kariuki. She's an experienced podiatrist, trained at the University of Salford in the United Kingdom, and currently practicing here in Nairobi. Well, she specializes in the health of feet and lower limbs, and her work includes diabetic foot assessment, wound care, foot care advice, cones and colors, ingrown toenails, fungal infections, painful feet and joints, and problems related to the structure and function of the feet. And for those of us living with diabetes, this is a particularly important session, because sometimes the feet can tell us a story long before we realize that something is wrong. So tonight we want to learn how to recognize those signs early. And Dr. Sally, we are so delighted to have you with us here in DTLC Season 13. The floor, and perhaps I should say, the feet are yours. Welcome.
Okay, good evening, everybody. Thank you very much, DTLC team, for having me tonight. I am here to speak about feet, a topic that I'm very passionate about. As you've heard, I'm a podiatrist, so I deal with foot and ankle problems. So having said that, I'll just jump into my talk. So my talk, though it's geared towards diabetes, what I'm going to talk about does apply across the board to anybody who's diabetic or not diabetic, but of course with a bias on diabetes. So let me just launch into this. Sorry about that. Excuse me, sorry.
Okay.
Okay, can you see my screen?
Yes, we can.
Okay, so I'll be speaking
Yes.
about common foot problems. Now, when it comes to the foot is very prone to getting issues. And the reason for this is because it's a very complicated structure. It has so many bones, ligaments, tendons, very small joints, and a lot of sweat glands. So because it's so complex, and because of where it sits at the end of our bodies, right down there, whereby most of the times we ignore it, we don't pay attention to it, it's carrying a lot of weight. That tends to predispose it to a lot of problems. Now, foot problems in diabetics are very, very prevalent. as of, you can see in these statistics, as of 2021, 24 million Africans were affected by diabetic foot problems. Then up to half of all non-traumatic lower limb amputations, that is half of all amputations that are not caused by accidents, are attributed to diabetes. That is quite a shocking figure. Then the implications of diabetic foot complications are quite high. I don't know how many of you have ever dealt with a foot ulcer or have had a relative who's dealt with a foot ulcer. The costs are mind-boggling. They run into hundreds and hundreds of thousands, sometimes even millions. Then the psychological effect as well. You have a wound, it's taking years to heal, months to heal. You don't go to work, you're in pain. Sometimes the wounds are quite smelly, they are big, you can't go out, you can't socialize. So the psychological toll is extremely high. And sometimes the wounds are so bad that they even lead to death, sadly. So foot complications at all costs must be avoided. And the good news is that 85% of all diabetic foot problems are preventable. So it doesn't mean that if you're a diabetic and you have a foot problem, it's a death sentence. No. There's a lot that can be done. How you handle it is what determines the outcome. So do not be stressed by that. So how does diabetes cause foot problems? The two main ways, I'm just going to speak about the two main ways. We've got nerve damage. Now, nerve damage, how it occurs is that if you look at a nerve, it's like an electric wire. You've got the thin copper in the middle. Then on top of it, you've got the colored plastic bit. So when it comes to nerves, the plastic bit that is colored tends to be a layer of fat. Now in diabetes, this fat can get eaten away and the nerves are exposed. If they're exposed, then they get damaged. Now the nerve damage can occur in three ways. We can get loss of muscle, and that is what we call motor neuropathy, whereby the muscles become very weak. And it can become so weak that sometimes it looks like a polio foot, a very high act foot. So if you have a normal looking foot and then it starts to become very high act, please seek medical advice. Then lack of feeling, which is the most common, whereby even if they take a knife and put it in your foot, you don't feel anything. But sometimes you will not feel me putting the knife in your foot, but you're in pain from, nowhere. So this one is called painless neuropathy. Then we've got loss of sweating, and this is whereby this in the feet, it presents as a lack of sweating, but in the rest of the body, it can affect the heartbeat, it can affect how the food is digested in the stomach. So these are ways that nerves are damaged by diabetes. Then damaged circulation, again, this is quite a big one, which leads to amputation. So this one, you get a wound, there's not enough blood, and the wound is not going to heal well. Why? Because what does the blood do? It brings oxygen, it brings food, which are things that support healing. Then if you get an infection, if there's poor circulation, the medicine that you take, the antibiotics that you take cannot get to where the infection is. And that means that the blood is not getting there and the wound is not going to heal. So nerve damage and damaged circulation are the main ways that diabetes can cause foot problems. So what are the predisposing factors of foot problems? The most common one is age. As we all age, aging comes with a lot of problems, as we all know, and a lot of medical problems. And it's like, you have to do a bit more maintenance. So age comes with poor vision. It comes with maybe comorbidities, which are, other medical conditions. It comes with lack of motion. It comes with poor diet. And all these are things that can predispose to foot problems. Then exposure to the environment, of course, harsh environment. If you're walking out there barefoot, you're walking where there's leaves, branches, moisture, again, your feet get wet or you trip and fall. Again, that can damage your feet. Very common one, improper footwear. How many times, I don't know how many times somebody comes to my office and I measure their shoe size and instead of wearing a size 6, they're wearing a size 5 or a size 4, very, very common. And I noticed that people, there are people who've always worn the wrong shoe size, but they've never ever known, and it doesn't click to them because you've always worn the wrong shoe size. It doesn't bother you. So improper footwear is quite a common one for foot problems. Also the design of the shoes, and I'll be talking about proper foot shoe designs later on. The design of the shoes also matters a lot. Then we've got medical conditions. Here we're talking about things like diabetes. Again, I've talked about that. Heart failure, which again brings about poor circulation. Rheumatoid arthritis, which will cause painful joints or joints that are deformed. Then neurological conditions, things like polio or any other nerve conditions that cause muscle weakening. All these are predisposing factors because they change how you walk. Then we have bony deformities. These are things like bunions, whereby if the bones are prominent, they cannot fit in the normal shoes that we have, and therefore the deformities get rubbed in the shoe, and consequently you get a wound. Then sports, again, we know sports is a big one for injuries, obviously because you're doing things faster and at high speeds. It can predispose you to foot injuries. Then weight, the heavier you are, the more the feet are stressed. So if we are a bit on the weighty side, then we need to really take care of our feet. Then lifestyle, things like smoking, this reduces circulation and can bring about things like gangrene and can even cause amputation. I actually saw a very sad case whereby a very a middle-aged patient, pilot, and he's a pilot, where we had to cut off one leg, then we cut off the other one, then we cut off the hand, then we cut off this one as an extreme case. And it was only because of smoking. So smoking, especially combined with diabetes, that is a double jeopardy. So kindly try and get rid of the smoking. And if you stop smoking, even if you have a problem that is caused by smoking and you stop smoking, it does tend to improve. So damage is not always permanent. So stop now and you'll improve your outlook. So how do you know you have a foot problem? Now, I've tried to pick pictures that are not very graphic, but it's good if people see pictures because then they're able to appreciate with exactly what is going on. Me talking about color change and not showing you a picture of it sometimes does not make sense when it comes to feet. So it's good that you see the pictures. They're not graphic. Appreciate them, look at them, appreciate them, internalize them, because this could one day save your feet. So color change. If somebody comes in with if you look at your feet and you see like that color there, you can see that's obviously something that is not normal. And this is quite shocking because I keep seeing this time and time again, and it is not painful. And I asked somebody, so when did you get this? Oh, it's been 3 years. Yeah, it's just getting bigger. Did you ever go to the hospital? No. Why? I don't know. It doesn't hurt, but does the getting black worry you? Oh, no, it is because it's become very, very big. So I'll just say something about that discoloration. That is actually foot cancer. And it's quite common nowadays. I don't know. It's like all cancers are a bit more common nowadays. It's not painful. It tends to be black, and the black just starts to spread. It starts from a very small thing and it just starts to spread. So if you see any black mark in your foot that is enlarging, please show it to your healthcare professional. The next picture there, that's what, again, color change looks in a white person. You can see that's a normal looking foot, but you can see this one is a bit red and discolored. For the rest of us who are who are dark skinned of African descent, you can see that's the normal looking foot there, and that one is discolored. That patient there had cellulitis, and then they had poor circulation, and eventually they ended up with an amputation. So if your feet start changing color, one of your legs start to change color, please seek medical advice, even if there is no pain, because sometimes pain is not a factor, especially in diabetics. Why? Because of nerve damage, okay? Then again, how do you know that you have a foot problem? You've got these fungal infections in between, like you've got that in between the toe, then you've got that peeling skin, and then you've got that one there. These are all different types of fungal infections. Now, this one is very, very common, but people don't take it as seriously. If you're diabetic, you need to take this very seriously, or if you have circulation problems. Why? It is one of the biggest causes for cellulitis. Cellulitis is an infection which gets in between the toes there. What happens is that because it's so wet in between the toes, it cracks. It cracks, then bacteria come in as a secondary infection, gets in and goes to the deeper muscles of the foot and causes an infection. The cellulitis, that infection is called cellulitis, that comes from this, can lay you down for months and months. You'll be in the hospital, it's so painful, you're getting very expensive medication. The medication can sometimes be too strong. People start getting into kidney failure. So it's very, very important that you treat this. Do not ignore it. It's extremely treatable. Then we've got this one, which is the scaly fungus. Again, a lot of people present with this and like, my skin is just a bit dry. I need to go for more pedicure. I need to go for my pedicure, but that is not always the case. This is a very common fungal infection. It's called scaly tinnitus, but it is very treatable. Then we've got this one at the far end here. This is yet another form of fungal infection, and this we call pitted keratolysis. And this is the one that produces the rotten smell in feet, but it's extremely treatable. There are a lot of people living in silence with this because they're very embarrassed and they're like, oh, I'll be told I'm dirty. Oh, it's a hygiene thing. It's not a hygiene thing. It's an infection, which is very easily treated. So don't suffer in silence, people. And then we've got any breaks in the skin. So the first one here, we've got the common, that's ingrown toenail, which is a very, very common problem. And I'm always surprised by how it's a very painful condition, having had it myself, but people suffer for years and years and years. And, I don't know, and it's so treatable. There's a permanent procedure we can do with this. We do it once and, it's sorted out. But people are like, but I've had it removed 3-4 times. But it's because maybe you're not going to the right people, to the right professionals, because the permanent procedure does not fail. What most people are doing out there is that you're having a conservative management done. But there is a permanent procedure that is done, which is not even a theater procedure. It's done in the office, and it tends to cure it once and for all. If you're diabetic and you keep getting an ingrown toenail, it can predispose you to having a toe amputation. So get it sorted out, please. Then we've got breaks in the skin. Wounds, even small wounds like this. Of course, I've picked, the best looking wound that I could find in my gallery because I don't want to shock you. But this is just an example of a diabetic foot ulcer. Believe it or not, this is the 8th year this patient has had this wound. 8 good years. It's tiny, but what does 8 years of having a wound do to you? As I'd said, the psychological cost, the financial cost, it can take over your life. So as soon as you notice any wound in your foot, please do not try and treat it yourself at home, because the earlier you present, the earlier we can heal it. But most people don't present early. And that is because maybe sometimes they're not in pain or because sometimes it's too tiny. Let us be the judge of what deserves treatment in the hospital and what doesn't deserve treatment in the hospital. So please, again, do not ignore an ulcer, no matter how small. Then we've got blisters. Blisters in diabetics, we don't tend to treat it like any other blisters, because a lot of people will come to the office and they're like, oh, I got this blister 6 weeks ago or 5 weeks ago, and I was told not to burst it. Why? Because we're not supposed to burst blisters. But that is maybe true for blisters in patients who are not diabetic. But if you're a diabetic, please treat blisters as a serious wound and go and see somebody about it, because there is a specialized treatment that is needed. Do not ignore blisters. Then, how do you know you have a foot problem? Again, thick, hard, dry skin. Now, the first one there, these are corns, as you can see there. Corns is a concentrated area of hard skin, which then feels like a pebble. Now, again, if you're living with diabetes, what happens is that hard area will put more pressure on the tissues, and then there's less oxygen in that area and it breaks down. The problem with corns in diabetics is that they tend to break down on the inside. By the time you notice that you have a wound, it's a bit too far gone. If you're therefore living with corns and calluses, you need a regular management by a podiatrist or somebody else who knows what they're doing to get the skin shaved off, and maybe get special shoes or insoles, which will help relieve the pressure and get rid of the corns. So do not ignore corns. Then we've got cracked skin. You can see how the hard skin there can crack. Again, people are living with these cracks and they're like, oh, my feet always, they're always a bit dry. But cracks are not always due to dry skin. There could be other underlying issues which are quite treatable. So if you see something like that, again, don't keep quiet, because if bacteria gets in there, again, it will cause a big infection. Then we've got the dry skin cracks, again with this, which can get quite bad. They can develop into deep fissures like that one, deep cracks like that one. And sometimes they're caused by fungal infection. So, if you see somebody, they should be able to assess and tell you where the cracks are coming from. You just don't say, I have cracks, my skin is dry. No, there could be another cause, things like diabetes, things like thyroid problems, fungal infections, even your walking style, even your weight, your shoes, all these are things that can cause cracks in the feet. So a good assessment will then help you get the correct treatment plan. Then again, how do you know you have problems in your feet? Swelling. Swelling is quite a common one. Now, sometimes people call me on the phone and they're like, oh, my feet are swollen. I've sent you pictures of my swollen feet. Tell me which medicine to use. I cannot tell you what medicine to use because swollen feet needs a very thorough investigation because there's so many things that can cause swollen feet. If it's one side on swollen and the other side is not swollen, that could be cellulitis, which is infection. It could be a blood clot. It could be a venous problem on that side. If it's both feet, it could be a heart problem, kidney problem, liver problem. It could be, again, veins. There's so much going on. So swollen feet are just not swollen feet. What is the cause? We can only treat if we find out what the cause is. Do not ignore that. Then we've got things like verruca. Verruca is a viral infection which is very much confused with a corn, but it's not a corn, it's a viral infection. Again, very treatable, more common in children than in adults because of how it is transmitted, but we do get every now and then an adult who will get it. Then we've got infections like jiggers, again, which are more common than you think, even in our urban society, very treatable. But again, some people never know that they have them because they have no feeling in their feet. And the jigger is there, it stays in there, the skin breaks down, and you pick up a bacterial infection. So again, how do you know you have a problem in your feet? Then discolored toenails. So we've got this one here. This is a fungal infection, which tends to present brown, gray, black. Then it gets thicker with time. It starts to crumble. And even though fungal nails in themselves are not, that's not something that's going to kill you or whatever, it just doesn't look nice, yes. But if it gets very thick due to fungus, then it puts pressure on your skin and you can develop an ulcer on the nail bed. And sometimes you're not able to see this ulcer, especially if the nail is extremely thick. So your sugars are going haywire, you're feeling unwell, you don't know what's going on. You come in, we drill that nail or we remove it and we find ulcer underneath there. So it's worth if you have very thick fungal nails, it's worth just having them professionally maintained. Then we've got blood blisters underneath the nail. How many times have you gone for a jog wearing maybe the wrong shoe or have gone for a hike, then you come back and your nail is very painful or it looks black? That means it's been bleeding from underneath. Well, for most people, it will just sort itself out in a few days. If you have an underlying medical issue, this can develop into a very serious wound. So if you're diabetic or you're living with any other of the health conditions and you get something like this, please seek medical advice. So thickened toenails are spoken about. So it can be caused by fungus, but also if you get an injury on the nail bed, this is where if you keep on hitting your toenail or you hit it very hard once, chances are that you will destroy your nail bed and it will always grow. Your nail will always grow thick. Again, why do we worry about this? Thick nails can cause wounds underneath the nail bed, on the nail bed themselves, underneath the nail. Again, how do you know you have a foot problem? Previous amputations. In these two cases, you'll see that client there, the big toe is missing, as you can see. Now, when the big toe was amputated, this is a type 1 diabetic, and he was just not very careful with what he was doing. He got an injury. Then the big toe had to be amputated. When the big toe was amputated, all the pressure moved down here. He then got an ulcer here. We treated this ulcer for about 4 years. It was a small ulcer, but it just took over his life. Then when this healed, because he lost some bone there, because he got a bone infection, the pressure then moved over to the second toe because the second toe now is behaving like the big toe. And, now there's an ulcer there, which is being treated. So if you have an amputation, then you most likely need to have some special insoles made to put inside your shoes so that we accommodate that deformity. Same as there, you can see these toes, number 2, 3, and 4 are missing. We only have number 5 and number 1. And because these supportive toes are not there, this one has dislocated and the top of the big toe is not there. All the pressure is on this particular area. And you can see there's a small ulcer there. So previous amputations need to be looked at very carefully. bony deformities, as I'd mentioned before. If your foot is sitting like this, then you cannot be wearing shoes that are narrow. You need a shoe that is either specially made for you, or you need a shoe that is extra wide. Now, in the Kenyan market, and it's a bit harder, and then the African market, to get shoes that are made for very wide feet, because the African market, we mostly get shoes from the Chinese market, and they cater for smaller feet. But saying that, it does not mean that the shoes are not there. They are there. You just have to know where to shop, because if you keep squeezing your foot that looks like this into a narrow shoe, you will get a wound on that area. Start getting some hard skin and you eventually get a wound. If you get a wound in this area or this area here, there's hardly any flesh. You end up with bone infection and, just some nasty infections there, and the wound hardly heals then. It ends up being, unfortunately, sometimes an amputation case. So shoes are very important. So I'm just going to say something else, because when it comes to the foot and taking care of the foot, heel pain is very, very, very common. In a week, I will see at least 15 clients who come in with just heel pain. So where does the heel pain come from? The heel pain can be plantar fasciitis, which some people will call calcaneal spur. This is where you wake up first thing in the morning, you put your foot down, and it's very, very painful. Or when you sit for long and then you stand up again, the heel is very painful. That is most likely plantar fasciitis, again, which is very treatable. Then we have Achilles tendonitis. This is pain that occurs in the back of the heel. The Achilles tendon is one of the strongest tendons, but it's very easily injured, especially in sports people or in some people who are taking certain antibiotics for long. It can happen, but it's hard to treat, but it is very treatable. But most people live with these conditions for years before they seek medical treatment. The more you stay with your pain, the harder it is for us to treat it. So seek early medical advice. Then we've got heel pain that is caused by reduced or hardened fat pad. Again, as we get older, we lose fat. So again, our heels can be very stressed because there's no cushioning there. But also in diabetes, the fat pad can harden if the sugars are not well controlled, and that can cause a lot of problems there. Then stress fractures, this we see in people who jump from high areas or people who do high impact sports, again, a common one. Then nerve entrapment on the heel, or even in the, sorry, not in the heel, in the ankle, and also in the lower back can cause heel pain. So heel pain is just not one cause, it's many causes. So you need a proper assessment. I see people rushing out to buy gel insoles as soon as they get heel pain. It is not the cure for all heel pains. Then we've got ball of the foot pain. That is the front part of the foot. So we've talked about the heel pain. Now, this is the ball of the foot, which is up here. So this again can be caused by pinched nerves, especially if you have a wide foot and you're wearing narrow shoes. And what happens is that you get the nerves that are in between the toes get pinched, and this feels like burning all the time. When you put your foot in the shoes, when you try to walk, it feels like it's hot all the time. Then you have capsulitis. This is especially common underneath the second toe joint. And this you mostly see when the big toe joint is not doing what it's supposed to do, or if the big toe joint is missing. If it's a weak one, then the second toe takes the job of the big toe and it can't handle, then you get capsulitis. Then lack of fatty padding, again there. Again, in diabetes, you can get hardening of the fat pad, as I said earlier. And because it's a high impact area, that can cause a lot of pain. And in rheumatoid arthritis as well, that can cause a lot of ball of foot pain, because you get some swelling, some swollen things like balls, which are called panas, which people confuse with cons. So let me just quickly go through suitable shoes. So these are my examples of what a comfortable shoe is, what a suitable shoe is. Now, I must say, people, that comfort and style don't go hand in hand. The more comfortable the shoe is, the uglier it is. So you've got to make peace. And I always tell people, on regular days, do comfort footwear. Then for parties, weddings, you can play around with your fancy shoes for a few hours, but make a habit of wearing comfortable shoes. It will save your life. Please remember that. So what are we talking about when it comes to suitable shoes? So wide fitting shoes. A lot of us like to wear the very narrow pointed shoes. Again, your foot does not look like that. Make sure that the shoe looks like your foot. Do not force your foot into a shoe that does not fit. So a wide fit at the front. Then deep toe box. So if you've got toes that sit like this, you need a deep toe box so that the top of your toes do not get irritated, or shoes that have stretchy material, something like this. Then thick rubber soles. Why do we go for thick rubber soles? Because every time you walk, there's a shock that is produced, and this shock goes through to your joints and can make your joints painful or can predispose you to arthritis. So if you have a thick rubber sole, the shock is dissipated in the rubber. That is why we go for rubber soles. Then a shoe with a fastening is very important. Why do we go for a shoe with a fastening? Because when you buy the moccasin type shoes in the shop, they feel quite good. In the first 2 weeks, they feel quite good. But then after that, they lose their snugginess, and they're like, a boat, you're just swimming in there. They don't give you enough support. But if you have a strap, you can always tighten the shoe and make the shoe conform to the foot. Then shoes with good padding in these particular areas. If you ever get a wound in the back of your heel, it is the most painful wound that I've seen my patients suffer from, where it rubs on the back there, where the Achilles is. So when you're buying shoes, it's just make sure that the counter, this part is called the counter, that it is not sharp, that it is padded. This is extremely important. If you get a wound in the back of the heel, you will not be happy. Then I'll also talk about socks, because you cannot talk about shoes without talking about socks. So we do recommend that if you're diabetic, you wear socks with your shoes. Why? Because if there's friction, then the friction will be between the shoes and the socks, and not your skin and the shoes. That's the importance of the socks. They are protective. Then the socks should not be too tight. If they're too tight, of course, they cut off circulation and they're quite uncomfortable. If they're too loose, then they fall down, they move down, and they bunch up at the end of your shoes and cause blisters. So not too tight and not too loose. Then avoid socks that have prominent seams. Why? Because they'll irritate, especially the top of the small toe, and give you corns or friction burns. Then wear breathable and sweat absorbing socks. Avoid nylon socks. Then if you have swollen feet, as long as you've seen your healthcare professional and they've given you the go ahead, you can wear compression socks, and this will control your swelling. But please do not wear your husband's, wives, sisters, relatives' compression socks. Compression socks need to be measured. It's shocking how many times I've seen problems or wounds that have been caused by people wearing compression socks that are not fitted. Compression socks, it's a medical device. It should be measured. It has classes, so you just don't buy whatever you see your neighbor wearing. It has to be fitted to you, and it has strengths. Is it a class 1? Is it a class 2? Is it a class 3? Yeah. So depending on your underlying condition, but compression socks can be very helpful. And do not confuse compression socks with anti-embolized socks, please, because I find people saying, oh yeah, I've got these ones, but they're very painful when I try to walk in them. The white stockings that you see people wearing in the hospital, those are especially for people who are not walking, okay, to avoid blood clots. They are not compression socks. Compression socks tend to be brown and black in color mostly, yeah? So do not confuse the two. So how do we go about preventing foot problems? I cannot say enough about inspecting your feet daily. I know it seems like, oh God, yeah, what? But this could save your life, just because sometimes people have got very poor vision, and they're not going to look at your feet. Get your neighbors or your family members to look at your feet. If they see anything, let them red flag it. Dry in between your toes very well. Why? Because moisture can cause infection. Apply moisturizer. Again, it will stop cracks. Or if you're hit by something and your skin is dry, it tends to crack and open up. But if it's moisturized, whatever has hit it will just bounce off and the skin will not crack. This applies to men as well, not just women. Then wear wide-fitting padded shoes, as I said. Do regular nail care. Again, it's shocking out there how many people don't cut their toenails and they wait until they're in pain to cut their nails. By the time you get in pain, it means you're causing the nails are cutting into your flesh, so cut them on a regular basis. Then avoid sitting too close to a heater, using electric blankets or hot water bottles. When you use a hot water bottle, please make sure it is covered. Then electric blankets, do not switch them on, yes, but do not sleep when they are on. Please switch them off at some time before you fall asleep. This is the season where I see so many burns and blisters from hot water bottles. Be careful, because the burns can be quite deep, and they do take a very long time to heal. So be very careful with that. And don't sit also too near an open fire. Then any cuts or bruises should be attended to by a medical professional, as I said, because we do need specialized care if you have an underlying medical problem. Then exercise is always good. So, and just to end my talk, I will say avoid self-treatment with sharp objects and acidic preparations. You need a professional to do that. Then every diabetic should see a podiatrist at least once a year. If you do not have access to a podiatrist, then see your diabetologist and ask them, remind them, to check your feet. So the things they'll be checking for are blood flow, nerve problems, muscle weakness, your shoe suitability, and they'll educate you on self-care. Then optimal sugar control is necessary to avoid foot problems. Then, as I always say, prevention is better than cure. Spend money having preventative care done on your feet, because the cost of treating a foot ulcer, I will tell you, is astronomical, both financially and psychologically. Okay. Thank you.
Wow, well, thank you too. I'm sure we have questions for Dr. Sally Kariuki. Yes, we are taking questions from now on.
Yes, so I have a question here. It's from online. Let me also post it in the chat for the benefit of others. It reads that should I diagnose with a doctor for diabetes if foot pain on one leg is consistent for a long time? Yeah.
So should I diagnose with a doctor for diabetes if foot pain in one? So pain in the foot is not always caused by diabetes, if I understand this question well. Foot pain can come from so many issues. So it doesn't mean foot pain is treated by diabetologist. No. As I said when I started this talk, my talk applies to diabetics and non-diabetics, because there are so many other causes, as you saw, for foot problems. So if you have a foot problem that, is really bugging you, then see a foot specialist and they'll be able to diagnose you.
Okay, very good. So should I apply Vaseline? I feel like my feet is dry. There's a little wound there and it's feeling dry. Can I put Vaseline?
No.
Why and why not?
Yeah, thank you for that question. When it comes to petroleum jellies like Vaseline, we don't always recommend them, because one of the things is even though petroleum jelly, okay, it's good for younger skin, for the older skin, it doesn't get absorbed into the skin immediately. So if it's just sitting up there, before it gets absorbed, it can trap dust, and then the dust gets into whatever crack you have, and you get infection. It may also seal infection in the crack, which then goes out of control. So I know petroleum jellies, everybody's like, oh, put a bit of petroleum jelly and you'll be fine. It is not a medicine, people, okay? It can actually cause you problems. So be careful with that.
It traps that, and not just that. So it might trap bacteria, and then there you are just inviting bacteria. Very dangerous. Another question is here from one of the chats. I have calc spur. The doctor said I need an injection. I feared. Is there another option?
Okay, when it comes to calcaneal spurs and steroid injections, I'm sure they're referring to steroid injections. Steroid injections can be part of the treatment. It is not the treatment, okay? It is not the treatment. It can be part of the treatment, but not for everybody. So what you need is a good assessment, and to find out what is your problem, what is the underlying issue, what caused the calcaneal spurs, then address the underlying issue, okay? So there are people who get steroid injections, but they have no effect, or it will mask the pain, for a bit. You'll be comfortable for 2 months, but then the pain will come back. Are we going to keep on injecting you? No, because the more you inject you, the more damage you do. And getting steroid injections, I do give steroid injections, but I'll never give you more than one. Why? Because steroid injections can actually deplete your fat pad, and you want fat pad in the heel. So I'm not saying do not take the steroid injection, but you must also treat the underlying condition, which involves, a lot of the times it involves biomechanics. So You need to treat the underlying problem.
So, and what is the danger if they don't do anything about it? Because
Well, if you don't,
obviously they have not done anything about it. The doctor said injection, they didn't take it. So what's the danger if nothing is done?
So if you have a calcaneus spur, which is painful, there are so many people who have calcaneus spurs which are not painful. So if yours is painful, which means you're having plantar fasciitis, what happens is that with time, you're getting less and less active. You get less and less active because now you're not walking because it's so painful. You then put on weight. Putting on weight now makes the condition even worse. Then you're having psychological issues because you can hardly go to work. Your relationship with your family is failing. You get psychological issues. You're then being put on antidepressants, which then make you put on more weight and just becomes a vicious cycle. Do not ignore painful calcaneus spur. It is very treatable. It can be hard to treat, but it is very, very treatable if you see the right person.
Okay, thank you. You've heard, eh? So please go and see Dr. Sally. She's based on Ngong Road, Paresia Centre, and we put her contacts here. Yes. Are sport shoes also recommended foot care? Recommended foot care?
I think you mean footwear. Yes. So sports shoes, yes. You've got to wear the correct shoe for whatever activity you're doing. How many times have I seen people in a hike wearing slides? It pains the hell out of me because, I know then they're predisposing themselves to foot problems. Yes, sports shoes are very highly recommended, depending on the activity that you're doing. And not all sports shoes are equal. It depends on your foot type. So if you buy a sports shoe, you wear it and your feet are feeling funny or they're painful, then it means that sports shoe is not correct for you. And you can see somebody who will advise you on the correct sports shoe. Yeah. And not everything that looks like a sports shoe is a sports shoe. Yeah.
Yeah.
You see very soft people wearing very soft shoes. But they're soft, they're sports shoes. They're not sports shoes. No. A sports shoe is a very sturdy, firm shoe that has support.
Yeah. I remember I had an experience, not a good one. So I used to run a lot. So I know I was wearing Asics, a certain type. So when my shoes was to be replaced, then I just ordered Asics. But they keep making different types. So this one that came, it was very tight. Very tight. And so I ran a few times and I was in so much pain. And I'm thinking, they are the best shoes. But I actually needed to go and get my feet fitted, and then they have to look how I step for them to recommend shoes. And so that's what I do whenever I get that opportunity. So don't just buy also, yeah? I remember the first time I visited, Sally had myself in the gym, and of course, I was wearing wrong shoes, so I had pressure at the wrong spot, and that affected was it sciatic nerve, eh? And of course, I was in trouble. Sally, do you remember you confiscated all my shoes?
Yeah.
And up to now, I wear proper shoes, can bet you. Yeah. Okay, Immaculate. I have my big toe I knocked since 2003. Once in a while, it pains, especially if I put on wrong shoes. Will it ever be fine? Sorry, it's not a laughing matter, but
It's
yeah.
not, yeah. So you've said something.
2003.
When I wear wrong shoes, it's painful, yes. So good shoes here is a thing. But obviously, if it keeps getting painful, then it means there must have been some damage that was done that was never addressed. So it might be worth seeing somebody.
So something was not addressed, yes.
Yes.
So surely if you've been in pain since 2003, you knocked that feet. Surely, my friend, don't you think we need to do something about it? Because that's how you get into trouble, right, Dr. Sally?
Yes.
Eh? Yeah.
Foot problems
That is 23
accumulate.
years.
They just start and they build up, they build up, they build up. Somebody comes in, oh, I'm having a foot problem. Oh, when did it start? I remember 5 years ago, and you're like, 5 years ago, what have you been waiting for? Because, we can only work with so much. So when you come and tell me, oh, my problem started 6, 7 years ago, and you tell me next week I'm going for a marathon, I need you to help me, you've put too much on me. So seek medical advice earlier.
Yeah, please get medical advice. That needs to be inspected. Something happened that needs to be sorted. So the lady who asked the question, Abby, I have a calc spur. She's actually living with diabetes. So do you have anything to add to that?
Now, if you're living with diabetes and somebody recommends a steroid injection, think twice about it. I'm not saying it's completely contraindicated, but I see a lot of complications from diabetics who've gotten a steroid injection for alkyl sperm because the response sometimes in how the tissues in diabetes behaves is not the same way as somebody else. So you've got to be very, very careful. A good assessment has got to be done beforehand. Otherwise, you can end up with a wound on that particular area. So I'm not scaring you to tell you do not have it, no, but yeah, you just need a very good assessment beforehand. And if it can be avoided, it should be avoided. If it can, if it is something else that can be done.
Because it starts slowly. I have seen so many people just get amputation because of something they ignored many years ago. Sally, what happens? Somebody just ignores a little blister, a little.
Yeah, and this is what I'm saying. Foot problems tend to be cumulative. They never start. It's rare that somebody will have an amputation because they were cut with a panga. No. To start with a shoe rubbing, some small pain in the heel, something, they got a small injection, I don't know, just something, the tiniest of things that you think, oh God, is this how my foot, this is how, it started. It's unbelievable. No? So this is what I'm saying. Attend, medical care earlier, just do preventative care. I know people feel pain to spend money, like on things that are so tiny, but if you're diabetic, this could save your life and your feet.
Yeah. Okay. Thank you. Very good. Another one here. I was given some silicone pads to put on my walking shoes because below my toes I get a burning sensation for a second. Lydia, can you just speak, please? It's long.
Yeah. So, yeah, they get a burning sensation for a second, then it lets go. It happens frequently as I walk, but the silicone pads help. Sad thing is that I can't wear the pads with every shoe. Is there a permanent solution?
Yeah, thank you for that question. Now, when we talk about burning, a lot of the times burning is related to nerves as opposed to cushioning. Yeah. So it's very rare that we give silicone pads for something that is a burning sensation. Probably how the silicone pads are helping is they're probably putting pressure on the bones, the metatarsal heads here, and spreading them apart, stopping the nerves from pinching. Yeah, that's probably how it's helping, but it's not helping as a cushion if you're talking about burning. So is there a permanent solution? It depends on where your problem is coming from. Assessment, medical assessment. Let us see what the underlying problem is. We deal with it, and I'm sure it can be sorted out.
I'm booking an appointment for her tomorrow morning. Come and see you. Eh? Yeah, even the one who calls Sally. You must be seen, my friend. Okay?
For
So let's
sure.
get that sorted out. Very good. Okay, so of course, we have very many questions, and people are not talking. Any other questions before Sally goes? This Sally has been supporting this program since it started. You've had 12 sessions. Do you know that? We've had 13. This is season 13. Thank you for keeping up with us and supporting people living with diabetes. What do we say, guys? Yeah, definitely. Thank you so much. So, well, I had a few questions, and where did I put them? Sorry, let me just find them.
Wait, there's one question here in the chat. Can I answer it?
Yes, please.
So,
Oh, yeah,
Viola,
yes, Dr.
yeah,
Yes,
I
go
keep
ahead.
having fungal infections, especially on the big toes, on and off. What could be the problem, and how can I overcome it? Thanks. So, thank you for your question, Viola. Now, the problem with fungal infections is the reason why they are recurrent most of the times is because they are not treated fully. So, what people do is they'll get some over-the-counter medication and they'll apply it maybe for 2 weeks, and then it looks better, and they're like, oh, it's gone. Then it will come back after a while, and it just becomes a cycle where it keeps going and coming back, going and coming back. The problem is you're not killing the yeast cells, you're not treating the fungal infection fully. Yeah, so it needs to be treated fully. Minimum fungal infection treatment is 6 weeks. 6 weeks is how long it takes to kill yeast cells, and that's the minimum treatment. Then if you've been using medication, you use it improperly, like you use it for 2 weeks, then leave it, then another, a month later, again, you've used it for 1 week. What has happened is that then you've created resistance, which then just holds on to that fungal infection. If you're using any steroid creams, again, to treat your fungal infection, it makes the fungus resistant to treatment. So yeah, you need to see somebody who's properly trained to sort you out. It can be treated fully.
Okay. I have some questions here from YouTube. My feet get very cold. Could this be associated with diabetes?
Okay. So cold feet, can it be associated with diabetes? Sometimes it can be because of poor circulation, but if you're not diabetic, most likely. But even with diabetics, it's not always that when you have cold feet, it's circulation. Like I have cold feet all the time, but I was born like that. It could also be because maybe you don't exercise enough. Sometimes the weather can affect some people. So yeah, there's a lot of this multitude of causes. So again, if it's something that is worrying you, you can see somebody about it and they'll be able to assess and tell you where the problem is coming from.
Okay, very good. Then also I have pain on my knee at time I get headache the right side of my head.
Okay, that one I will tell you, I have no clue what to say about that one. Maybe, the knee has its own problem and the head has its own problem, and maybe you're just associating them. So I would say seek medical advice, let your headache be checked out, what's causing it, and let the knee be assessed, and let's see if there's any connection. But so far, I've never come across somebody with knee pain and head pain at the same time, which are connected.
Somebody also have said they are itching inside their head. Let me just ask, since they are on YouTube watching this program, is it something that you can answer? Then we still have another question. Yeah. They feel like they're itching inside their head. Nothing to do with the foot, but what do you think?
I'm a podiatrist, so I don't want to comment. I don't know. I don't know what to say about that one. Maybe somebody else in the group, can answer.
Yeah. So I think if anything is disturbing you, it's affecting your health, there's something wrong. Listen to your body and go and see a doctor. Okay? Yes. That is what I can say. Thank you, Dr. Sally. Okay, I have a question here from Portia. I have pain in my feet, suspected to be plantar fasciitis. My feet are constantly swollen and have thickened nails and painful feet. Yeah, okay, there's something hiding there, I can't see. So thank you very much for your explanation. It shows I need to seek for help. I also have pain in my knees.
Yeah, so you've been listening, so good to see that comment. So yes, it's more of a comment. Yes, please see somebody and we'll be able to help you.
Yeah, very good. And are there, I know Portia lives in Tanzania. We have some people here from Zambia. We have people from Zimbabwe, South Africa, East Africa generally. So do you have an association that there are people in these countries that we can refer?
So
They have to come to us, come to Kenya.
It's hard. I know in Tanzania, I think there's one person. I don't know if he's still there. South Africa, there's quite a number. Zimbabwe, I haven't heard of anybody. Or Zambia. Zambia might have, I don't know, but
yeah.
So yeah, we're not that many, but because I think podiatry is not that well recognized in Africa, even though there are so many now Africans who have studied, but people are just not coming back to Africa. I don't know what's happening. But more and more are coming day by day. So eventually, yeah, people will be.
Yeah, but yeah, they can book your appointment. I'll even put the number on the YouTube. Book your appointment and go and see Dr. Sally. You can travel to Kenya and visit DTLC headquarters. We'll be happy to welcome you home. Okay? Yes, we have champions who've been here for a while. They're still here today. Do you have any questions? Can we hear some voices? We've discussed a lot, but hearing voices is also usually good, eh? Yeah, Sally, there's a time you taught us when should we go to, if I want to buy shoes, when should I go to buy shoes? What time of the day?
So the best time to buy shoes is in the afternoon, eh? And apparently a study was done and 3 o'clock is the magic time. Now, why in the afternoon? Because when towards the afternoon, towards the end of the day, it's like you've been on your feet are at their maximum size. They've swollen the most at that time. All of us, whether we are diabetic or healthy or whatever, all of us, our feet do expand during the day. Yeah? So if you buy shoes in the morning, and you're like, oh, these shoes, they really fitted nicely in the shop. Now I've worn them and they are pinching me. It's because you bought them when your feet were at their slimmest. So it's always best to buy shoes late afternoon. That's the best time to buy shoes so that you get the exact width of your feet.
Okay, very good. And then how do I know? You say many people come to you, they're actually wearing not good shoes. They're always wearing a small size. How do I know if I'm wearing a small size? What assignment can you give us to find out, to investigate my size, my shoe size?
Yeah, the best thing to do is take a piece of cardboard, trace your feet while standing up, then cut out the shape of your foot and put it inside your shoe. Then remove that piece of cardboard. If you remove it and the front is bent, it means then that shoe is too small for you. Then the other thing to look at is the front of your shoe. If you can see your toes from the top of your shoes, then it means then that shoe is too tight fitting. If your big toe is touching the end of your shoe, again, it means those shoes are too small. If you're having pain across all your nails, when you're wearing your shoes, they're not ingrown toenails, but the nails hurt every time you wear your shoes, that could mean that also your shoes are too small. So tracing your foot on a piece of cardboard, then cutting it out and putting it inside your shoes is a good indicator of whether the shoe fits or not. Because when you remove that piece of cardboard and it's all bent at the front, it means that the shoe is not fitting.
Yeah. Okay, very good. So are there any more questions in the chat, Lydia?
No.
Okay, very good. So somebody is asking how much consultation. Please call the line we posted here tomorrow and they will discuss with you. And I know they always, whatever rate they give you is a special rate related to DTLC, others you pay back.
Yeah, and let me tell you, people, when you go for a foot consultation, if you're diabetic, so you go in with, oh, okay, I'm having pain in my toe. So whoever is seeing you is just not gonna go, okay, pain in your toe, let me see the toe, okay, this is the problem. They will first do a full diabetic foot assessment. They will check for your circulation. For example, I use a Doppler to check your circulation. Then we've got tools where we check your nerve status. So we've got 3 or 4 tools where we check what your nerves look like. We look at your dry feet, we look for fungal infection, we look at your shoes. Then at the end of it, we'll also give you an education session. So it's just not, we just don't dwell on that problem that you've come with that day. No, we do a full assessment.
Yeah. Yes, and it depends. You might actually need many other things, like you said. Yeah, so don't limit yourself because of knowing the price of consultation. How long should you take to change your shoe?
Now, changing shoes depends on how much you're using them, because we cannot say everybody should change their shoes in 1 year or 5 months or 6 months, because we're all not the same. It will depend how much are you using the shoe, what are you doing with that shoe, what is your weight, what kind of ground are you walking on, because all these things are, things that will affect the shoes. For example, if you're person who walks, from here to, to wherever you're walking 4 kilometers every day, and there's somebody else who's using a car every day and they're wearing the same shoes, those 2 people are not using their shoes in the same way. So we cannot generalize. It depends on how much you're using the shoe. Then you look at the padding in the shoe. Has it gotten, is the padding gone down? The sole, has it become thin such that when you step on stones, you can feel the stones, because you're not supposed to feel that? Are there any tears in the shoe? The wear and tear. Those are the sort of things you you look at to know whether or not you're going to change the shoes. Then when it comes to sports shoes, again, okay, most of us are not professionals. I know professionals have got, if you run certain miles, you've got to change the shoes. But when it comes to sports shoes, look at the wear and tear of the sole. Or if you wear the shoes and then at the end of whatever activity you're doing with your sports shoes, your feet feel achy. Yet before they are not feeling achy, maybe then you need to look at whether the shoe is worn out.
Yeah. Okay, very good. Portia, you had a question? Okay, so say, had seen Podiatrist in 2019 in South Africa. He made molds and also the foot insoles he made have not really been helpful because they make the shoes too tight. So does it mean you need to get large size shoes?
Now, depending on what problem you have, the size of your feet, and because I don't know what your feet look like, huh? So one of the things that we always do when you're fitting the insoles is to try and get an insole, to make an insole that is going to fit that person's shoes as long as they have comfort footwear. They are not shoes that are made up for style. Because unfortunately, shoes that you put insoles in must be shoes that what you call orthopedic like shoes. You cannot put them in your fancy shoes. So the thing you'd have done probably is to go back and say, oh, my shoes don't, the insoles don't fit in the shoes. Then maybe he could have customized them a bit more. So it doesn't always mean that you need to get a bigger sized shoe. Maybe it's the design of the shoe. Maybe what you needed was a deeper shoe or a wider fitting shoe.
Yeah. Wow. Thank you so much, Dr. Sally. Thank you so
There's
much.
a question there. There is a rise in Mutumba shoes sale on TikTok. What should I consider? Can you recommend? Yeah. Now, when it comes to Mutumba shoes, we cannot, what can I say? Mutumba shoes are there. They do help quite a lot of people. And even I have bought Mutumba shoes. Every now and then I do buy Mutumba shoes. Why? Because for me, in the Kenyan market, that is where I find my most comfortable shoes. Because my feet, I have a wide fitting foot, and it's very rare that I'm able to get shoes in the regular shops. Now, the secret or how to buy shoes in Mutumba is buy camera or grade A shoes. What does that mean? Camera or grade A shoes are shoes that haven't hardly been worn. So if you're spending very little money, 100 bob, 200 bob in Mutumba shoes, you've got to start thinking, then look at that shoe. Has the sole been eaten away? Don't buy it. Why? Because then it has already taken up somebody else's foot shape. The biggest problem I see with Mutumba shoes is how they clean. I've been to the UK in one place where they pack the Mutumba shoes. That place you've got to get in with gas masks and stuff because of the medication they use to that Mutumba smell. The Mutumba
Sterilize,
smell,
yes.
Yeah,
Yes,
it's a
yes.
sterilizer which is very strong. But what happens is that when these people get the shoes, they wash them, maybe most times in dirty water, there in the river in Gikomba. Then they stuff them with nylon papers or some rags which are not dry. And what they're trying to do is to give the shoe shape, because when it comes in the Mutumba, it's been squashed. So that's what they do. But then these shoes then don't dry. What happens? Mold grows. When mold grows, what is that? Fungus. Then you wear the shoe and you get a fungal infection. So the grade of shoe that you buy from Mutumba is very important. So grade A and camera will ever hardly have that problem. Yeah. And I'm talking as a wearer of Mutumba shoes. I have never had a single issue.
Thank you. That is very helpful to all of us. Well,
Because this is where you're
don't
going to
just
find the
buy.
best shoes most of the times.
Yeah. Okay, wow. Thank you so much. You've answered so many questions. We really appreciate. So, what is your parting shot to all of us about shoes and about our feet? Living with diabetes or non-diabetics?
When it comes to feet, prevention. Feet can be hard to treat. They can be extremely hard to treat. Why? Because they carry so much, they carry us for the rest of our lives. Now, you do not want to have a very painful retirement where you're not being able to walk. And what you do earlier on in your life is what is going to determine these things. So prevention is better than cure, people. Spend your money on preventative care. Don't wait until you have to do curative care.
Okay. Thank you very much. I'll hand over to Lydia. Maybe she has something to ask you, and then we can
Yeah.
end.
For sure, we are so thankful. What an important session this was. I think many of us will never look at our feet or our shoes the same way again. Thank you so much, Dr. Kariuki, for spending time with us, reminding us that when you're living with diabetes, foot care is not a cosmetic care. It's an important part of diabetes management. The small blister, that crack, that change of color, the wound, this should not be ignored, for sure. Thank you for making this so practical and for showing us the images there. They weren't really shocking. We weren't that scared, but thank you so much for showing them. We needed that kind of clarity. So we check early, we act early, we seek professional help early. Dr. Sally, on behalf of DTLC family, we are truly thankful for sharing your expertise with us. So would you like a consultation with Dr. Kariuki? We have posted her clinic phone number on the WhatsApp group, on the Zoom chat, and we'll also do so on the YouTube description. Reach out to her. We have an assignment for the week. It's actually a nice exercise to keep us busy during this week. So we'll share that tomorrow. And then we'd like to see your cardboard cutouts and then how it went with the shoes that you have. So just like that, dear friends, our evening has come to an end. Like we said, we have a challenge. Of course, a big thank you to our doctors, Dr. Alice Ojwang for organizing all this, Dr. Sally Kariuki for that important and practical session tonight, and to every member of our DTLC team working behind the scenes. We really appreciate you. Of course, our dear participants on YouTube, on Facebook, here with us on Zoom, you are the reason we are here. Tonight, we were reminded something very important. Your story does not have to look like somebody else's story. Perhaps someone you know has lost some weight, more weight than you. Their blood sugar has improved faster than yours. Someone exercises constantly. Celebrate them. Do not use their progress to measure your worth or your journey. This is week 11, not the end of the story. So if you fell off somewhere along the way, start again. It's not too late. You can still do it. For now, those of you who have been following us on YouTube or Facebook, we have a message for you. I know you've been thinking, I wish I could actually go through this program properly. This is now your opportunity. We are glad to announce that registration for DTLC Season 14 is now open. Would you like to go beyond watching and actually become a part of a community that learns together, supports one another, asks the questions in the group, takes on the weekly challenges, and work toward meaningful lifestyle change? Come and join us for Season 14. Starts September 14th, 2026. So perhaps you don't need the program yourself, but you know somebody who does. Could you sponsor someone to participate in the DTLC program Season 14? You could be a family member, a friend, a colleague, or even someone who may never be able to afford this kind of a structured diabetes education on their own. Season 13 was very special this season. It was completely free and open to participants around the world, allowing us to share diabetes education and support without barriers. Season 14 will continue this journey, but with a participation fee to help sustain the work behind DTLC. Of course, your contributions enable us to continue bringing together health professionals like Dr. Sally, developing quality educational resources, supporting participants, and even expanding DTLC to reach more people. So you will find the Season 14 registration link on our social media platforms. If you're watching this on YouTube, simply look at the description box. We'll post it there. Then you can register for the program.
It's already there. Oh.
Is it? Okay, we'll post it right after this. So as we close tonight, I want to leave you with this. Your feet carry you through life. Take care of them today so that they can carry you into a healthier tomorrow. Check your feet, check your toes. Keep making those small changes. And remember, we are not yet finished. Thank you for joining us this evening. Have a wonderful week ahead, and we'll see you in week 12. Good night.